Okay. Hey everyone, I'm Dr. Lena. I do want to take a minute to introduce Camille Canty. She's actually our new nurse practitioner. High five. We are happy to have more help in the office. Camille's great. She was actually one of our nurse practitioner students, actually 2 times. Yeah. She liked us so much. She did it twice. She even came back for Halloween.
I did.
That's impressive. And anyway, she's a family nurse practitioner. We thought she'd be a great addition to the team to help us not only in the office but with house calls and some of the telemedicine. And because she's family, she can even help take care of some of our parents who call me all the time because they're sick, and I'm always telling them to call their provider. But anyway, so that way she can help out in that way too. Today, I just wanted to do a really quick COVID-19 update. Last you heard from me and Dr. Kelly was a few weeks ago. Really weren't having a major problem, and now I think we've moved on to having a problem. And so I just wanted to do an update. And you know how in Houston you have a problem, they are closing the rodeo.
Yeah.
So I think that for a lot of people's bar, they're closing the rodeo is like their bar.
That's the threshold.
Yes, and they're like, uh-oh, and so we already have schools being affected, colleges for sure being affected. My daughter's home from college. I don't really know that she's going back. We haven't heard yet, but I doubt it, to be honest. I was going to run the Boston Marathon in April. Don't think that's happening. I don't even think I would want that to happen at this point. So I just wanted to update you a little bit and tell you about things we're doing in the clinic and to correct some information, just because I've had so many texts and calls from frantic parents wanting to know about testing. So I just want to touch on that real quick. We already included a link. I did a post earlier today that was a link to the Texas State Health Department COVID-19 page. At the bottom is a number, a hotline number. It's the same number I called this morning. I don't recommend you all call this number. That will overwhelm the system tremendously. But the questions I were asking were clarifying certain things. And I will tell you, we have basically the same information that you have, meaning through this website. We're not getting any other special information. I have printed it, and it does change, so that's why going to the website to make sure it's up to date. But for example, this is the testing guidelines, and these are only the people that can be tested. So one of the misinformation I want to send you now is just because you want to get tested because maybe you're exposed to someone whose kid in the class or something, someone came from another Egypt or somewhere where you're worried, that doesn't meet criteria to be tested. So the website's very clear on testing. We have limited resources with testing, and also of course limited resources clinically, which if this gets much more out of hand, we'll have limited resources there too. So the World Health Organization has officially declared COVID-19 to be a global pandemic. There is a Netflix documentary called Pandemic. I don't know that I recommend you watch it. But it touches on the Spanish flu, which was in 1918, which is really our last big pandemic. Globally killed millions. Obviously a huge problem, and before we had Tamiflu and other medicines. But with this particular virus, we're in a little bit similar situation that we're struggling with some of the treatment, and the patients who seem to be dying are having bilateral interstitial pneumonia, which is basically acute respiratory distress syndrome, where their lungs, can't be saved, and dying of respiratory failure, and then of course multi-organ failure and so forth. So it is for the people who die, it's actually a terrible condition. It seems that it is true that certain populations are more high risk than others. So older grandparents, for example, anyone over the age of 65. I know it's really high fatality if you're over 80. And so like my in-laws are more in that age range. And so that does make us think, definitely we would not see them if we were sick. And it seems like it's really sparing the pediatric population. Now, part of that, we don't know exactly why, but part of it could be they're running around with colds all the time anyway and have like these little antibodies because that's how their immune system learns and grows. And then sometimes we just have certain things that affect certain age groups. I always kind of say, hey, chicken pox, they did pretty well when they were little, but if you're older, they got pneumonia and had other complications. So, every disease is a little bit different from that aspect, but still The spread of the disease can happen despite, different ages. It's just the fatality rate might be different if you're in a certain population. So older, and then of course anyone who has a chronic condition, lung, heart, kidneys, and that's really kind of encompasses a lot of Americans and a lot of people in the world who have some chronic conditions.
Or immunocompromised.
Right, or they're immunocompromised, they're having cancer and getting chemotherapy. So currently, at least as of today, there's at least over 115,000 cases globally and 4,200 deaths, at least over 1,000 cases already in the United States. And so I think a lot of parents are like, hey, what's the worry, what's the concern? And I think part of the concern was how quickly in Italy things, as we say, escalated. And the concern is if that same escalation happened here, we could overwhelm the system. And so one of the ways to try to prevent that is to start using common sense and doing this idea of social distancing. And some of that is why they will end up closing schools, the rodeo, right? Mass gatherings, conventions. I know one of the outbreaks from Boston was actually at a Biogen convention where the topic of discussion was COVID-19. And so, but conventions, you meet people, you shake hands, there's lots of you. So they're already been canceling those things. Do I anticipate they'll cancel or limit attendance at sporting events? I do, to be realistic. Do I think the schools will close? I do. I mean, the realist in me says, well, it makes sense. For the number of times I have a parent call to say, my son might have the flu, there's 5 kids in his class with flu. And I'm like, well, he probably does have the flu. So, places where people are in close proximity, they can spread things quite easily. And that's why every year we have a flu epidemic as well. Malls, think about places, when I think about places to avoid, mass gatherings, conventions, the rodeo, I would have already told you to avoid the rodeo, malls, and that's kind of the same advice I give people with newborns was, don't go places with a brand new baby who has no immune system where there's lots of people because they come in contact, especially during respiratory season. So if you use those same ideas for yourself as for 10-year-old newborns, so a little bit of isolation. Sporting events, which I mentioned, okay, cruises. For a few reasons we won't even touch on, probably would avoid cruises. They're turning away most of the cruises from some of the ports, and it seems that people have definitely, it's a bit of a petri dish.
Right.
We've always known about the norovirus, which is dreadful also, but this is, it seems to be a potential hotbed as well. So the travel industry might be currently saying it's okay to cruise. I don't know. I didn't read the latest on that. I can just tell you, I don't think anyone would advise anyone over the age of 65 or anyone with any sort of chronic condition to cruise. And I do want to remind you, people have gotten sick even who aren't elderly. And people who are younger adults, meaning not like 50 and up, have still died from this. And so to keep that in mind. Okay, sharing foods and drinks. We all like to go to the Mexican restaurant, and then we all take the chips and guacamole, of course. Most people don't double dip, which is good, but everyone putting their hands into the same food container over and over is how you spread things. Sharing drinks should be kind of a no-brainer.
Right. And
I see parents and kids do it all the time. Like for example, even if your child is sick, like kissing them on the lips, it's risky. This is where I think
back hand, foot, mouth.
Yeah, I mean, I think they've said a fist pump is way safer than shaking hands at this point. The elbow, the foot. Texas, we're a state that loves to hug, and right now, I guess we're gonna have to give air kisses from afar.
Be less friendly.
Less friendly. But anyway, going back to sharing our food, like even at the dinner table, it's better just to divvy everything up and everyone just consumes in their plate, and we don't pull off other people's plate and share. So that's kind of an easy thing to think of. Hospitals, so places to avoid. If you don't need to be in a hospital, I would probably avoid it. One, the system might get overwhelmed, and 2, you're going to have more exposure to not only that, but the flu, and we still have a lot of rhinovirus, which is the common cold, going around. We have tons of flu still going around. So your exposure rate goes up, especially in places where there's a lot of people who are coughing or are sick. So let's not overwhelm the hospital system. Okay, things you can do, because that all sounded pretty bad. Things that are outdoor, the fresh air, is okay, and hiking and being outside. If they end up, next week is spring break, and then if they actually do close schools, which we think they will, and they already have a couple in town, these kids are going to be, inside of it. So yes, going outside will be okay. Now, I will tell you, the allergies are insane out there right now, and I'm an allergy sufferer. Me and tree pollen aren't friends, and it is nuts out there. So I feel safer inside right now, but out fresh air, at least for spreading this, is safer. Homework. I just, as a pediatrician and mother of 4, just need to throw out there that if they close schools, your kids will get homework. Please let them stay on top of their homework. This probably isn't the time to do tons of group sleepovers and fun, and let's go bounce at the trampoline parks or things like that. If they actually close the schools, it's because they're trying to get people to social distance, and that's what that means. But help your kids by staying on top of the homework, because we also don't want to be in a situation where everyone's just now behind, and now I don't know what will ultimately happen if schools get canceled for the school year. I will say I'm not really sure what the next few weeks brings. I'm definitely more concerned than I was a few weeks ago when it was isolated in China and we were trying to reassure you. And I'm mostly concerned after seeing what's happened in Italy and Europe, and that I feel that Houston is this very international city with 6 degrees of separation is more like 2 degrees of separation. I always know someone who knows someone else in this town, which is amazing to me. And I have bumped into people in France who were from Houston who knew someone I knew. It's amazing. I feel like this world is so much more connected than ever before. And just know that, and that's why the social distancing, while it might be hard, it's just something that might become very important. So take to heart what does happen in other countries so that we can try to prevent that. Now, I wanted to touch on a few things in clinic so that you know kind of where things stand in clinic. Yes, we're open. I do want you to do me a few favors if you're in our practice. If you're concerned your family has been exposed, which many of you have called, call. That's the right thing to do. But we are going to refer you to the fact that there is testing. I can't tell if you're going to see this backwards or not, but there's very specific testing guidelines on the web under the Texas Health and Human Services, the Department of State Health Services website that we'll put the link down there. It can change, and so that's what's important, to stay up to date on the information. But right now, they're not testing people just because you think you might have been exposed. They are very specific guidelines where you are actually having fever and significant symptoms, and you happen to be any person who's close contact with someone who's laboratory confirmed case within 14 days of symptoms. Fever and this cough and shortness of breath, and a history of travel from the affected geographic areas, like Italy, for example, within 14 days of symptoms, or an individual with high-risk factors. So that's why sometimes the people maybe who are immune compromised or much older, they might be testing them because they know their risk of dying is very high. And then fever and signs and symptoms of lower respiratory illness, like the cough and shortness of breath, that actually require you to be hospitalized, they're probably going to test those people if they've not identified, even if they haven't identified a source of exposure, because something made them that sick. And of course, they'll test them for flu and other things too. I will remind you, the flu is still our #1 enemy when it comes to the number of Americans that have been affected and the number of deaths. But the mortality rate is much lower for the flu than it is for this virus, which is why they're working to contain it so that we don't end up in a bad situation. Okay, so for our clinic, to remind you, telemedicine is your friend. Everyone has the doctor's here cell phone. And so in the evenings, I always tell people I prefer to have the phone ring. We have telemedicine communication, available to us to where we can do televisits. So that's obviously an option, especially if you think it's something that is easily for us to treat without you actually coming to the office. Just limit exposure as much as possible if things get worse. OMD is our HIPAA secure texting platform, and we love OMD. I call it OMG. OMD is very active. I mean, when parents have questions about this, rashes, fever, runny noses, whatever it is, we get a lot of OMD messages. We reply really promptly. If it's during the day and you're worried, by all means, call the front desk, and Destiny or Camille or Claudia, someone will pick up the phone during work hours, and so we need a same-day visit or a telemedicine visit. We do house calls for our patients. I think house calls are about to be a lot more popular.
Yeah.
Things get a little bit out of hands, because I think people who do decide to kind of socially isolate will kind of like that feature. We do not do house calls if you're not in our practice. I get asked that question all the time. So I'm sorry, we just don't have the capability, but for patients in our practice, we do offer that as a service. Don't forget, you have our cell phone number. You all know how to use it. I know you do, because most of you have called me. Stock up on necessary medicines. So these are albuterol. Your EpiPen should be up to date. If you have diabetes and you need insulin, you should have insulin. So even if you're not one of our patients and you're just watching this, if you need refills, now would be a good time. Just make sure you have those things, especially the real vulnerable populations, so that you're not suddenly trying to get access in order to get these things at the last minute. I remember specifically Harvey, Hurricane Harvey, for those of you who don't remember. I think we all had some PTSD from Harvey. And I remember trying to get prescriptions sent and having to dig up the one pharmacy. I mean, for a while they weren't open, and then finally having one that was open, and I was having to send prescriptions there. We used a lot of telemedicine during Harvey. So the good news is you can reach us, but sometimes that's why telemedicine, comes into play. I also wrote down, and this seems a no-brainer, but wash your hands. I feel like if nothing else, we've all learned how to appropriately wash your hands. And I know there's this idea of not touching your face. It's impossible. You will touch your face during the day. It's literally impossible to not touch your face. But use good common sense, lots of hand washing. If you tell a kid not to touch their face, kids pick their noses on a regular basis. That's just their thing. I mean, so you'll never, obviously, so in the pediatric realm, this idea of not touching, the kids not touching their face, it's not gonna happen, right? But we can do our part, like I said, social distancing, good hand washing measures, etc. We would like to take this time to say goodbye to Lucy.
And all the other toys.
Yes, I mean, so one of the big changes, for us is until this is a little bit more settled, some of the things that you can do is, we're going to remove some of these things where kids like to touch them, even though they're cleaned over and over and over and over again, just out of an abundance of caution. Hopefully you won't have to see us wearing any of those fancy N95 masks. I mean, that would be a goal, so you don't have to see us in that. But, even in your own home, think about things, get them a little bit more clean. Just remember things that kids touch a lot. And one of the points I made in the office is kids crawl on the floor, babies crawl on the floor. The next patient comes in, they get on the floor and they crawl on the floor. I mean, there's no way you can ever overly bubble wrap an area or your house. So it's more of just using good common sense, wash your hands, sneeze into your elbow or shirt somewhere and cough. And most importantly, for at least this next spring break week, if you can stay away from vulnerable populations and like your grandparents, especially if they're over a certain age, like 80, if you have any symptoms at all whatsoever, so that we can protect them as well. And then of course, they can protect us. So if you have any questions or you have any comments, please let us know. Those of you who have my cell phone number, you're welcome to call me. I don't know if I've helped any fears at all. I feel like the rodeo being canceled, just like I said, escalated this a little bit for most people. But I think it's important and necessary to do that. And I think it's hard sometimes to see that rationale. I know my own 19-year-old daughter was like,
in tears.
because she wanted to go to the rodeo. And I said, well, I don't think it's not going to happen, but it's for the better good of, like, the greater good of the world at this point. So let us know if you have any questions. We will try to give another update as things change, if something major like changes. And then don't forget to check out that link. And please get most of your information from the CDC, the World Health Organization, the Texas Department of Health Services, etc. Reliable information that's very specific. That's, I think, the most helpful thing that we can do. Okay, thank you. Bye.